This meeting will be video recorded and broadcast over local access channel 8 and through the town's website at www.eastham-mass.gov. And today is not there yet. December 10th, 2025. It's 6:30, and this is the Human Services Advisory Committee meeting. And at this point, we have everyone here. And we also have Irene Hammer from Outer Cape Health. So we are going to just jump right to, speaking with Irene, and Damien will be joining us. So there he is right now. I will let him in. So that. Right. Hi, Damien.
Hello, good evening.
Good evening. It's been a little confusing today, but I'm glad you got in and we're all set to go. And so we're recording. And the floor is yours and Irene's at this point.
Thank you.
Welcome.
Thank you so
Awesome.
much. We're delighted to be here, actually.
Yes. So Irene, I'll do a general overview, and then I'll ask you to fill in because you partnered with me to help write this wonderful grant. And thank you again for inviting us to talk about our grant request. This year, Irene and I are really focused on overcoming the challenges and the headwinds that we're facing, giving a very rapidly changing policy environment, expectations for significant changes in how we're going to be reimbursed to do our mission-driven work. And so they say necessity is the mother of innovation or invention. And therefore, we're taking that approach at Outer Cape of looking at how not we're going to worry about the future, but overcome the challenges ahead of us. And there are two things that we see as the way through these challenges. One is by continuing to double down on supporting our staff to be supported in the work that they do through team-based care. And in short, what that work is to support our clinicians to practice to the top of their licensure or their certification, and to remove as many non-clinical tasks and work from them through the adoption of technology.
Okay.
In addition to that, what we wrote in the grant for you is really a focus on leveraging telemedicine, telehealth, and hybrid work to the maximum capacity, because the writing is on the wall for us in terms of not being able to think that people are going to suddenly start moving to the Cape in droves and afford the expense of living here. While there are some of us that are very privileged to be able to find housing that is stable and secure, especially for the mixture of staff that we have at Outer Cape, that is often not a reality. And many of our staff struggle with having secure, stable housing, regardless of their professional title. I've seen every level of staff come and go at Outer Cape, and part of the reason is the expense of housing or living on the Cape. Now, many other parts of the country have, out of necessity, had to pivot to maximizing access to clinical care by using telemedicine. And Outer Cape, we used it as a means to get through the pandemic, but we did not invest in it the way that some other healthcare facilities invested in it as an alternative to in-person care. And so that is the approach that we're taking, and we're doing it from the ground up, starting as if we're pressing the reset button on telemedicine as one of the options, because it does two things. One, it will help us to get rid of our 800 plus patient wait lists, which, by the way, we zeroed out from 2000 a year ago. And over just a single year, it has built back up again to 800 patients. So the demand for our services across the Outer Cape and Lower Cape is crushing. And that is something, as a physician myself, I feel very deeply, because I know that primary care and preventive care is the best way to keep people at home and safe and well cared for. Waiting until something is already escalated to the need to see a specialist or go to hospital in an emergency is unfortunately not wise, especially in areas where we have such a deficit of healthcare access and support. And so we see telehealth as it has been done in other healthcare facilities that have no choice to use it. It can be done extremely safely, and maximize the access to care for our clinicians, and will also help us to recruit folks who don't need to live on Cape, but they can come on occasion, and we can house them temporarily to do parts of their in-person care, and then they can go back to wherever they can afford to live for the other percentage of the time. That's the model that we're going to use. We don't want people to feel like they will never see their clinicians in person, but we're just going to, find housing that allows that rotation to occur, because that is something that we can help them with. I'm going to stop there because I feel like I've said a lot. And I can't, I can only see Irene's reassuring face that I'm not saying anything that's off the rails.
Okay. No. I'll hide her so you don't feel, no, she's, yeah, you can go ahead, Irene. I'm sure you have some things to add.
Yeah, well,
It
you know,
sounds
as an Eastham resident, we know that we have a much higher education rate than most of the rest of the country. I was actually just looking at this statistic that 52% of our residents have at least a college degree.
wow.
So this is so telehealth. I think there's going to be, there's some concern about adoption. I think that this community is really going to embrace it. I know as a working woman, I love the idea of telehealth because I don't have to sit and go into an office and go to a weight room. I do want my primary care visit in person once a year.
Right.
But for the occasional sore throat or the other things where I need to be seen, this is a tremendous convenience.
Yeah.
And I think we need to really think about it that way. And I believe that this community, of almost any community, will truly benefit and embrace this model that we're putting forward. So in addition to creating sustainability, it's going to be beloved.
Well, I think it certainly is I mean, it's like thinking out of the box, and it's coming up with a solution that can, even if it's patchwork to begin with, I think, we all know computers aren't going away and various, but as long as there's the real person behind all of this, and also that that occasionally you will get to see a real person. But I think in the telehealth visits that I have had, I have often felt like there's a lot closer attention paid to me, and that the conversation is really listened to almost better than sometimes when you're in an office and there's more going on around you. And even if maybe it's on my part that I feel that way, that I am able to focus more on the provider, but I think that there are some really positive things about telehealth. And if it means that more people get that access, and with somebody who has their file or access to their file, as opposed to going down to, Orleans and going to, the emergency care. I mean, it just feels when somebody can look and see what your history is, and, oh, you get bronchitis every year at this time. And then they can, they know that, okay, that this is probably what's going on, and these are the things that have worked for you. As long as the person that is able to do that type of thing, then I think it really could free up.
You guys use the Epic chart.
Yes, we're on Epic.
Okay.
As our electronic health record, yes.
My chart, okay, I was curious about that, and then I think it's a great idea. It's a great idea.
Damien's brainchild, you know.
So, and I think,
Yeah.
COVID was meant to give us that emphasis to go ahead and, get past whatever barriers are.
Yes, I think COVID did sort
Yeah.
of give us that
Yeah.
chance that we had to do it, or it was the safest way to do it, and to have more of them.
And Damien has a study where there's a statistic that 80% of all primary care visits can be done safely by a telehealth.
If it's done well.
If-
Nobody wants ice cream that doesn't taste good. So
Yeah.
our goal with the investment and your support is to build telehealth to be as equivalent to an in-person care visit as possible. Which currently, if you were to call us now and do a telehealth visit, your clinician is the front desk person, the nurse, the MA, the tech advisor, and doing all those things without a lot of support. So it's even a lot of duress on the primary care clinician to do telehealth right now.
It shouldn't,
Yeah.
it should be, I wanted to ask you about this thing, the Doximity licenses?
Yes.
What is that?
So Doximity is the platform that we use to do video visits, and they have a cost. Yeah.
Mhm.
Yeah. Okay.
And we have to expand our licensure for everybody to have a platform that is privacy secured. So even if we find a cheaper alternative, we still need to have a video platform because telehealth is best done with video, not with phone.
No, I think it has to be really.
Yeah, I think you need
Definitely.
How
to
do you
have,
guarantee privacy? Is it through this doximetry?
Yes, the Doximity application or others like it, because we may be able to find as we advance and we may be able to find a better option, but the platform itself is what they call HIPAA secure.
Okay.
Mhm.
And my other question would be, how do you manage an acute emergency during your telehealth visit?
Yeah. So all of our clinicians, although they've had pandemic experience with this, will require re-education around appropriateness for a telehealth visit. What we're also going to be investing in, as I was telling you before, right now, if we did our version of telehealth today, the clinician that's seeing you is doing all of the triage and rooming virtually and all that type of stuff. In the telehealth experience that we're going to have in a year's time, or hopefully sooner, that clinician is going to have the same level of support by a team as they would as if they were in person. There will be a telehealth nurse, there'll be a telehealth medical assistant, there'll be a telehealth front desk person or digital navigator. And so all those folks, just as if you were to walk in and the front desk person like checks you in and says, "Hey, Miss Johnson, like you don't look so well. What's going on?" And you say anything like, "Oh, I'm having chest pain," or something that it falls into our like red list, we will call 911 for you immediately. So there are all these safety measures that we have in place to do it.
Are you also connected to like my chart?
Yes,
Health and, okay,
yes, we have care everywhere in our Epic.
good.
okay, that is nice, so that they could access a lot of information, because I think that
Mhm.
to me, that's one of the keys, is having the background of the
Yeah.
person.
Yes.
Once you, because that is so much a piece of the picture. And when you are dealing with people who are, like, mass health, or, potentially struggling, you also wonder, where else have they tried to go? And you want to make
Mhm.
sure you have access to all of that information.
So
Well, this is Felice, in that context, what do you envision your relationship to be with the local visiting nurse groups or private nursing groups, or perhaps if someone has
Yeah.
the funds, they may be seeking, more private care if they can afford it?
Yeah, that's a great question. So we currently rely heavily on the VNA for people who are homebound or for some reason can't come into the clinic. So that will continue. Um, I do also believe though that if if the way that we hope this takes off continues, we will stop folks from even wanting to feel like they need to get in their car to come and see us. And we will also need to supplement the VNA nurse army, I call them, because they're doing the brunt of this now. And we will need to invest in hiring clinicians who, rather than being in the clinic waiting for you, will go to your home to help with a telehealth visit with a clinician that may be somewhere else, and do the blood pressure at home, especially for folks who really should not be traveling, right?
Yeah.
You know, we have a certain we have a significant population of patients on the Cape that are highly independent, um, uh, uh, in what I call their wise years. And so this is the time that you want to make sure that people aren't putting themselves under unnecessary risk, which I worry about it every time I drive on Route 6. And I really feel like we need to do better with that. So the VNA can't do that all by themselves. So there's that opportunity too, but I think that's a phase two where we start to move our clinicians out of the health center itself and into people's homes whenever we can build that capacity. But this is the foundational step toward that. I do think it's a back to the future type of situation where you're going to go back to having the doctor come to your house and do home care more than you're doing having you come to the health center in the future.
When you think of it, it actually, instead of sitting in the waiting room with
Yep.
a bunch of other people who are ill,
Hmm.
you,
Yeah, that's visionary thing.
yes, it is.
You can imagine a digital navigator coming to somebody's home, saying, can I help you get onto this
Right.
screen?
Right.
Pulling up the screen, having a real virtual clinic experience right from your house. It's kind of incredible.
It is. I mean, you are asking for additional funding for this. So are you searching out other grants or such? Because I know,
That's all I do.
yeah, there you go. Then I turn this way and talk to you. Because we have like the Navigator program, that there is other funding that is coming through the town. And, you know, we know that that has been quite successful and really expanded or really supported people to make sure their health care actually is supporting them. But for this type of thing, what are you?
So we're going, of course, to all the towns, but in addition to that, we're going to private foundations. So last month, for example, I wrote 4 grants totaling $150,000 in requests to various foundations. This month, same thing. So basically, I average about 4 grants a month, with a team. You know, I have a consulting team that we work with. And I would say, yeah, every single, with the exception of Lily Lulu, every single grant I've written is focused on
It's very visionary. I mean, it really is the future. There's
Right,
no doubt
right.
in my mind about it, and just.
I can see,
The
right,
Federal government was getting touchy about telehealth when they were rolling stuff back.
yeah.
So, you know, I don't know if that's a temporary, nobody knows what's happening, but.
Yeah. What I would say to that is it would be unusual, although not impossible, for our
Right,
country to be the only country that does not move forward telemedicine, because everywhere, people are realizing that this is the only way to expand access to care in a convenient way for their populations. So this is a global phenomena. It's not a local issue.
And having worked in Georgia, where there were a number of rural hospitals that shut down,
Mhm.
in many respects, this is going to be the model for rural health.
Yeah.
Mhm.
All over the country, and the red states even need it more than us,
Yeah,
so.
the mileage they're traveling.
Yeah, it wouldn't be in
Yeah.
the Republicans' best interest to shut this down.
Well.
Yeah.
Well,
Excuse me, I
because
have-
there's probably fingers in
It
some
might
of
catch
those
on, it might
pies,
catch on.
but what is to, I mean, I just want to make sure that it is a real doctor and not an AI person. that
Yes,
is-
yes.
Yeah, yeah.
For now.
Yeah.
Well, the thing about AI too, is the way it's gonna be used, it's gonna free up the administrative work so the clinicians can do clinical work and do the things that are relational.
Yeah,
Because it's that
because AI
relational work that AI will not replace anytime soon.
yeah.
You're
Excuse me,
asking
this is Felice again. I have more of a technology question for you.
Sure.
We are in the sticks, and Provincetown happens to have a decent infrastructure.
Mhm.
Eastham is so, but everywhere else on the Outer Cape, particularly Upper Wellfleet and Truro,
Yeah.
has
Have access.
miserable internet service. And I was wondering what your thoughts were about
Yeah.
being able to overcome that
That.
challenge.
Yeah. So this is where our partnership with the state and with the Department of Public Health, as well as the Executive Office for Health and Human Services, comes together. We were one of 4 health centers that were invited to help the state write a grant to the federal government for that $50 billion in rural health transformation. And a significant ask in that grant that the state is making is to invest in improving broadband access in rural areas specifically. That is something that we do have to continue to advocate for. And having a robust model that works where there is good access and demonstrating the impact, I think is actually going to help
Mhm.
escalate the investment in it rather than not having evidence to say, look at how it's transformed the access for residents in Eastham and Provincetown, et cetera. Local towns may then be more excited to engage in doing their own investments in improving the infrastructure as well.
Right. And then you also have the challenge, let's say, for a primarily elderly population.
Yeah.
Some people are more technologically in tune than
Yeah.
others. And I was wondering what your
How
thoughts
are we going to
were
do
on
that?
that.
Yeah.
Yeah.
So I think Irene nudged toward this. So we're doing what is called appreciative inquiry, and our Navigator program for supportive social services has been so wildly successful that we are adapting that into this telehealth program, and we're going to be rolling out digital navigators. So these will be people who are on that telehealth team specifically to support people who are naive to telehealth or resistant to telehealth or need some type of support. And whether
So
it
they
is
have iPads with them or something. that they can-
exactly, or how it works, because why I may sound really confident about this is because I rolled this out previously at another health center on the North Shore of Boston. So North Shore Community Health, which is the health center that I came here from, we in the pandemic took the idea of, oh wow, this is so good. We need to keep it and make it like sustainable beyond COVID. And so what they have is, and what I think we will adapt to is having these navigators who are identified to people who need support, and they will, let's say it's your first visit with telehealth or you were identified by your clinician as someone that needs support. They will call you 2-3 days in advance of your visit and say, hey, Ms. Johnson, I'm Damien, the digital navigator working with Dr. Hammer, and I'd like to make sure that you're comfortable with getting on the technology. I can do this over the phone. I can come to your home. What are you comfortable with? And they do all of that work in advance because the benefit on the other side, if we get people comfortable with telehealth, is well worth it because you
Mhm.
get access, we can deliver the services, we can get people off the wait list. And we've seen that be successful in health centers that have invested in it. But you need the upfront investment, right?
Okay.
It won't grow legs unless you give it the opportunity to grow. And that's why we're basically shaking the trees everywhere for this, because we don't have a lot of time, given how challenging we know things are going to get in the next couple of years.
Yeah,
You're asking for $7,500 more than you did last year.
but for
Is
this,
that right? What percentage of the, and you may not know this exactly, but if you could give us a ballpark, what percentage is that 7,500 of your total cost to do this?
oh,
Oh,
but I,
gosh.
Yeah.
The ballpark, the
Yeah.
ballpark.
My suspicion to really roll this out appropriately, it's going to be probably $750,000
So
to
it's
do
about
it
10,
right.
less than 10, it's 1%.
Yeah. That's not
Mhm.
one.
1% about.
Don't you think?
Yeah, at least.
At least, yeah.
at least,
Thank
Yeah,
you.
what the analogy that I would share with you is, imagine building a full clinic building, but it's
Yeah.
virtual. That's what we're
Yeah.
doing. We're
Yeah.
essentially building a new site, but it's a virtual site. It needs the same types of supports and people and infrastructure. It's no less expensive, but but the returns, given where we're headed, are absolutely necessary.
um, yes, and I'm just thinking ahead to trying to really help navigate getting this funded. Because, we've been asked to sort of try to keep things at a level funding. We're not happy with that as a committee, to be honest. But also, this type of request is so different and unusual.
Mhm.
We probably, I'm gonna have to get a hold of Jackie. I mean, does the town, have they heard of this already? Or is this the first time you've really approached, like, the town of Eastham?
Well, I will say that Damien did a beautiful talk in Provincetown on December 1st, where a lot of government officials attended.
Okay,
And it is very abundantly clear that we're going to need the support of local government and philanthropists in order to get through these interesting times. So I think there's appetite. Damien, what do you think?
Yeah, I believe your financial controller was in attendance at that meeting.
okay.
Yeah.
That's big.
Yes.
Yeah,
He was very well dressed.
Rich,
nice.
that's
Yeah.
Rich.
Rich, yeah.
Yeah, Rich was
And
there.
potentially our next town administrator, but
Mm.
but that, so I just, that was what my thought was. Do they have some sense of this? Because I feel like it is a really, it's not a big ask considering the total amount.
Right.
But I'm sure you're looking to see that for looking at private donations and other grants, all the towns buying into it.
That's right.
So
Mhm.
that you can say, everybody is wanting to support this.
That's right.
And so I will be starting with Jackie tomorrow and trying to see what can, where it can go, because I'm thinking that it's almost like a separate little piece.
Mhm.
And because they, often come to us and say, if you have something particular,
Mhm.
we have a couple of different issues that we're dealing with, but this one just seems like the fact that there's 800 people sitting on that waiting list and it's
And
new.
growing.
And it is growing.
Mhm.
And because we know within the next month, the rest of this month, there are going to be people who are dropping their health insurance, but yet they're
Mhm.
going to need a way to access healthcare. But that, they, and so there aren't many places to find a new provider.
We know there's a lot of needs, but there's a reason why Emerson said the first wealth is health. Right? I mean,
What?
the first wealth is health.
Okay.
Yeah.
Without
Yeah.
health, you can't focus on anything else.
You can't focus on anything else,
Do
so.
you have a sliding scale? Is that how you charge?
Yes.
Yeah,
I'm
we,
not
because,
sure. That's how
yeah.
you charge?
yeah, all federally qualified health centers, which Outer Cape is one of, we must provide care regardless of ability to pay. And that is how we determine what the fee would be for someone that does not have insurance, or they earn a certain level of income.
And lastly, non-English speaking
Yeah.
patients, how do you
Mhm.
manage them? And how will you in the telehealth world?
It's a great
Yeah.
question.
Yeah, so there are lots of, because of the pandemic, we've learned how to like get interpretation services into telehealth visits, even if it's plain old like telephone. But in this model, we will have a robust interpreter service available, and those navigators and front desk telehealth staff are going to help us to have everything ready before the clinician gets on the call. So all of that is what makes the telehealth version of the version we're moving to palatable for people as an alternative, not as a second class experience.
Right.
Right,
The
right.
other thing is, if you think about it, we can now hire in a telehealth model clinicians who don't necessarily live nearby.
Right.
So,
Who may
you know,
have a
maybe.
different language background.
Exactly.
Yes.
Gives more opportunity for diversity with respect to language.
Yeah.
Yeah.
Yes, yeah, and, yeah, because it is difficult to find, to get housing down here. I mean, there's
Mhm.
just no question about it.
Yeah.
And, Eastham is trying their own things to try to, at least house people who are already here.
Mhm.
And, let alone somebody who's coming from, it just finished medical school. How can they afford to buy anything?
Yeah.
And, but yeah, a young, clinician, somebody with a family and
Mhm.
such, it's just to find anything that's available. You look at the prices of housing and it's astronomical. And,
Mhm.
we have people who are in more house than they need and it's, but there's no place for them to go to, so.
Mhm.
So do you see some of these technical, I think of them as technical navigators as opposed to healthcare
Yeah.
navigators.
Yes.
And, okay, so we go outside the health field to help people set
Mhm.
up in their homes with and
Yeah,
walk through.
yeah.
Yep.
So you can get kids, young people who
Mhm.
have, done some training and
Mhm.
even started with college and done some. Who could be the ones who could start, because it could be a great position.
Yeah.
Yeah, and you can see there's workforce development that can come out of this,
Yeah,
right?
yeah.
It could be
Yeah.
truly, students coming out of the community colleges who are
Mhm.
focused on, technical skills.
Mhm.
There's a lot of positive here.
Yeah. And also, I actually think telehealth, when you have the prep for it,
Mhm.
which is what you're really focused on, puts the person who's receiving the healthcare at ease.
Yes.
And then it also gives the clinician a lot more time to be focused on what they need to be focused on, makes
Right.
better use of all the resources.
Mhm.
But I think, the day or two ahead of time of saying, we make, see if the system works, if it's not working, to kind of walk someone through that is essential. I think with our elderly population especially.
Well, and we've got, all the senior centers can be in on some of
Yep.
the training and such, I
Yeah.
just feel like there's a lot of places, because they're already doing more of that.
Mhm.
And it, could really be, it's not gonna get everybody,
Yeah.
but it is a start,
Yeah.
and.
Yeah.
I
And
know
and
I
and
have a
we
brother-in-law who accesses medical help through Mass General,
Mhm.
and and he's in Western Mass. It's a
Yep.
2-hour ride, and they actually take the train in and stuff when they have to go in, but for regular, his every 2 months after an MRI, he doesn't have to travel,
Yeah.
and they get
Yeah.
a team. And they get to talk to different people, and it really makes
It's
a
very efficient.
difference.
Very efficient. Very
It really helps.
Yeah. And I just want to circle back on something, because Irene and I have had so many conversations with community members, stakeholders, donors about this. And
Mhm.
one thing that we really did take away is that we want to provide folks with more options for care. We're not going to take away
Mhm.
which you already have access to. But we're also confident that if we do it well, if we invest in it properly, you will have options that you like to have,
Yeah.
and not that you're forced to have. And it's really important to move at the speed of trust with every single patient. with this technology. So having those additional supports and getting people comfortable, as you said, with this, I think is going to be a win-win for everybody if we can do it.
Yeah, I just,
I think you will do it.
I know he'll do it.
yeah, it's a very hopeful,
Yeah.
you know.
Yeah.
It's good.
That's,
And
that's,
that's exactly it, right? Instead of woe is us, how, you know, this
Right.
is innovation.
Yeah.
This is innovation and this is, we
Change is
don't
never
need
easy.
this right now.
It's never easy, but if you go the positive route, it opens up doors. Yeah.
Yeah.
So 100%.
well, yeah, all right.
I'm excited, I'm excited.
Doing a great
Yes.
job.
Yes.
Right now.
Yeah, yes.
What you're doing.
you.
And because you offer, and it's not just the absolute care, you know, somebody going in and getting their regular weekly checkup. You've got so many other things going on, you know, and you've added the endocrine access to that, you know, that program. And, you know, just doing, you're really looking at trying to provide all, you know, more care for people. And I think that it, you know, it can't,
Yeah, go
We-
wrong, right?
right,
Yeah.
and you can't, we can't
Yeah.
go backwards, we need it, I mean,
Right.
our population deserves this.
Yeah.
Um,
Thank you.
for your advocacy.
Yes.
And, you know, it's lovely to have such champions.
yes,
Get
well,
that money.
yes. Figure it out.
Thank you so much.
So, but, and if I need to, I will get a hold of you if we need
Yes.
more, you know, if what needs to happen is that you need a direct conversation with them or the select board or whatever, because Rich, if he was the one who was there, has got to dig that money out of someplace.
Mm.
But I
I'll
think he
talk to
can,
anybody about anything.
Yeah.
Yes.
you know, and I think that, it will be something that it's the beginning of something, and we should be proud that we have this, that's going to be happening
Yeah.
and could be a model for many other places.
Right.
Absolutely. Yes. We want to
And-
be an example.
Yes,
Yeah.
yes.
I agree.
The best hire they did was getting.
Right? Me, 100%.
I have to feel, I,
100%.
you know, after meeting him last year and this, it's just really wonderful. So thank you very much. And,
Thank you.
hopefully
Thank you.
that we can, you know, at least provide you. And if we can't get it all, every penny of it, we'll try to come up with something.
We appreciate it.
Thank you so much.
Thank you.
Yeah, yeah.
Thank you.
And we appreciate it. And thank you for jumping in early and waiting out in the rain with us and
Pleasure.
everything.
You all have
No
a
problem.
wonderful holiday.
Yes.
Yeah, yes.
Bye.
Thank you.
Stay safe, stay healthy.
Stay healthy.
Stay dry.
There we go.
Yeah. Take care, everybody. Thank you so much.
Thank you very much.
All right. Take care. Bye.
Thank you, Irene.
Oh, it's such a
That nice
pleasure.
bag.
Thank you.
Yeah.
It's such a pleasure to meet you. Thank you for all you do, because
Yeah.
Oh,
you're doing this for volunteers. Gosh, love you.
we just get to sit here and have a wonderful life.
Oh,
I know. We're lucky on the Cape. There's a lot of good
we
organizations.
really are lucky here.
Yeah.
Yeah.
Yes, we are.
Thank you for everything.
Yeah.
Thank you.
Yeah.
Well,
That's exciting.
it's very exciting.
Yeah, like the whole pellet.
And this is one of the things that when they usually, it's,
To me, today, this morning, when I wasn't feeling good, and I'm like,
Yeah.
all right, we gotta go to the ER, you know? So
Yeah.
I go there, well, urgent care isn't open, you go to Fontaines, they're like, well.
We send it to
Yeah,
ER
we
anyhow.
send you to the ER. High blood pressure, go to ER. Yeah.
Oh, painful.
But. But the ER waits, but. Well, what if they're nice,
yeah,
you
yes.
just pull up somebody and say, this is what, these are the beds I take, you know,
Well,
should I take extra, should I do this, you know?
Because my husband did it after his knees. It was during COVID, but you know, we didn't have to go back to the doctor in Boston, you
Mhm.
know, to have him look. They could, you know, because it was video, they could see the incision
Wow.
site. And it was mostly questions anyway
Yeah.
and stuff. So it was really, you know, and he was being followed by the VNA and, you know, a PT. So I think that it can solve so much of the log jam of
Mhm.
appointments
Right.
by having this, because there's many that don't need to be person to person. They can be face to face and you
Mhm.
can get the information,
Yeah. Right.
you know. And I thought your question about as acute emergency is, but that, as he said, it'll be more training for the people. They're going to have to, learn the whole model, which is all part of the cost and
Yeah, I mean, it
everything.
sounds like
But I
they're gonna
think-
have to develop a whole triage system.
Yeah.
you know,
Mhm.
Yes,
so they'll have-
it's a
My
whole,
question, I
Very-
asked them,
just
who
make
are the
them-
clinicians? Who are the clinicians? Are they?
We got a list
Nurse,
there
are
in the
they?
back of the. paper.
I know, I was looking at it and I got this, it was just.
yeah.
Yeah, this is,
Stellar.
yeah.
Well, I think that it might be some of both, and it may depend upon the particular person or what they are calling in about, because if you called in and needed an appointment or emailed in, because you might be doing this online, they may,
See, to charge for telehealth.
yes, it would be a different rate
Have
for,
to be very, yeah, they have to be very, very careful. I'm sure he knows it all.
oh,
because he
yeah,
is
yeah.
Obviously quite sharp.
It's almost like going back to the old fashioned, house calls.
And that's what he said, that
Yeah.
occasionally there could actually be a house call of somebody, and I just feel
Yeah,
like
they get it, I'm sure they'll get it.
it
off
sort of
the
feels like, okay, maybe I can age in place a little easier, you know?
ground.
And and the pre-call setup is probably gonna take place 2 days ahead of time to make sure the equipment's working. people are
Yeah.
comfortable.
Yeah.
There's another check-in point.
That's another
Yeah.
thing.
It definitely is another check-in point, yes, and such, so.
Do they have other doctors other than primary care? Yeah, they got psychiatrists, they got.
Wait, you'd asked about the
Yeah.
psychiatrist.
Yeah, curious how many, how many patients they have.
Yeah, right, and how many.
So they said-
But it was interesting to say that they have basically, it's almost like they were using that model in
Yes.
physical presence
Yeah.
to work on.
Triage to send them on.
Right, to figure out all the different cases, and now they really don't have any backlog in with
Oh,
it.
yeah.
I think like surgeons are doing that. There, there's been a real shift from the doctor to PAs. nurse
Because for many of the things, really, that's all you need, and they're more attuned with actual symptoms of things and not doing all the diagnosing. And,
They have women's health, optometry,
Good.
yeah,
PAs.
I was first introduced to it in the mail.
It's not
At the very beginning.
go to your general.
Yeah.
I was,
And they're sending you to the orthopedist, they're sending you to cardiologist, they're sending you, they're just evaluating you.
Yeah, to see
So
what,
that's why I was curious as to
Yeah.
what they have here.
yeah,
but, and part of that is that it's then you can go and you get more complete care right through them too, but I think they could add in other areas of health
Yeah.
because they could attract those providers,
interesting.
because they could live elsewhere.
Right.
yeah,
And that's a piece of it, is to,
Yeah.
doesn't have an x-rays taken at wherever it is on the case, get read by, Mass General or wherever the hookup is in
Yeah.
Boston. So they're all done.
right. So it'll be interesting, to see, and I think that I will get a hold of Jackie and see, and even, and ask her what she has heard about this, if she's talked to Rich, and that
I think this is one of the more critical things.
I think it's important that we ask for this separate from any other increase that we were thinking of.
What does they get separate money, right?
They get,
Which
it's
is-
like a 37,000
What?
pass through. That's for the Navigator program.
No.
And that comes from grants that have been written, but the towns have to accept the money and then it gets funneled there. And we do that cooperatively with several different towns.
Mhm.
So that has, and again, that started sort of like this on this trial basis, and it worked. So then they went and sought bigger grants. So what he's looking at is getting this trial going, and the IT questions were excellent questions to, that how are people who maybe don't have good service going to access this?
Yeah.
And, but what it is trying to sort of make sure of that, or if the digital person goes out and he can't access it, then they know that this person can't be one who can use it.
The other thing I was gonna ask them is, for a situation like that, could they set up in like the senior center and then on a weekly basis, if I don't have access, it's the transportation there to then have my telehealth visit there?
Yeah.
Potentially, yeah.
I mean, you could do it.
I like it.
It's, the transportation is always an issue.
Right. Do it at the
Maybe.
library, you could, yeah,
Exactly.
you really could.
Yep.
You know,
And-
you have
and
like an
there's-
office.
I think that.
Well,
once
I
it's
think,
functioning, then it will become, some of those things might end up being,
Part of it.
possibility. Or the other thing is, like, the library has hotspots.
Yes, that's what, yes, that they would go there to the hotspot.
And you can bring it to your house if you have no internet access and you have internet access. So they could have hotspots they bring with them that might work. Because they do, I mean, I've used it in my family's home when we didn't have cable or didn't have internet access there. And they really do function fine.
Yeah, I followed one. I
From
didn't
the
do that. I
library.
borrowed one for another family.
Yeah.
And she knew how to use it.
Yeah, yeah. But that's a way, and they probably in their funding will be
Right, it'd be part of this.
buying some of this, yes. So.
So that's good. And that's what I'm sending
I'll
out.
just ask a question, Kate,
Mhm.
about our previous year's funding.
Yeah,
It's so in 2024, we funded 89,000.
Yeah.
yes, that's with the
25 in.
for Outer Cape Health in
Okay.
there. So that second Outer Cape line that says 25,000, then this past, this year was, or last year was 37,000.
Uh-huh.
That's sort of money that gets passed through us. It's some of that grant money that
Right.
is doing. So,
So they went from 25 in 2025 to now they'll be getting 37.
yes,
They've
yeah,
gotten $12,000 more
yes.
for this year.
And, well, it was actually through last year too, and then it will continue on. But,
2025, it says 25.
right, but we're in 2027 that we're working on now. And last year, when we made our decision in June, it was for 2026, FY 2026.
Okay.
So we did have a little increase from FY 24 to FY 25,
Okay.
that, $4,000. Which was, not a lot of money, but it was there. And we were able to juggle because we had several people that didn't come, when we don't have an agency apply and we have that money that is in our account, we rearrange that money and give it to other agencies. So, I mean, at this point, we have that $4,000 from Independence House, but I would assume they're going to come back next year.
So how does the town determine exactly what they wanna give us? What they want?
It has just been, they started out with a particular amount at some point in time. I mean,
Okay.
it's 1982 or something like that. They started with this.
Yeah.
And occasionally we would get a 2.5% increase
Okay.
as we went along. And that's how they have determined the money.
Okay.
At some point, they decided to use our line in the budget as where the funding sat for this extra money for Outer Cape Health and for, Food for Kids. There's some of that money is also, from our town, a separate funding that we support, the
So
family
is this a
support
drug-
package.
Right, that we get, why it's separate? Is it? The
It's-
37,000?
It is some kind of a government grant, I
Okay.
believe, and stuff, but it is something that we can't say, oh, they shouldn't get, unless we found that they were really not doing it, but we know, I mean, Jackie hears from the fire department and the police
Yeah,
department and even from, people that they are, it's very successful. And it's been replicated in other places
Right,
because it
right.
was successful and they've gotten more money because of it. This big rural health grant was, part of it was
Okay.
because of that Navigator program. So what they're starting to do is sort of another level of that.
Mhm.
And they're looking to get nominal support from the towns for that project. And, besides getting what they want is pointed, money that's pointed at that funding. So we could ask for that money and it would be going only to that. It wouldn't go into the general money to pay for uncompensated care.
Okay.
It would only go to the telehealth.
Okay.
And,
I don't think, from what I'm looking at here with these numbers, I don't think we'd be asking for a great deal more money. Somewhere between 16,000 to 20,000.
Yeah.
From the town.
They will
And
never
even though
give us
they
that.
have level funding.
they will never give us that.
No.
If we were to ask for another, even
Ten.
say $5,000,
See,
I think we should ask for 10 and have them back us down to 5
For the best.
and let us smile.
I'd say ask for 20.
Ask for 20.
Ask for 20 and then let them,
All right with me.
this way.
Well, if we asked for the 20 and that included the 7,500,
Right.
Yes.
right,
Yes.
Exactly.
Yes.
It does.
then potentially we could,
Yeah.
yes.
Yes.
All the asks is $89,650. That's
Yeah.
what it is this year. So,
Yes.
Mhm.
left our fund
Mhm.
is 16, so that's 20,000.
Mhm. Mhm.
Give me that number again,
That would be
89,
my
we ended up 89 what?
Desire is to just ask for it all.
What was the number, 89 one?
The total-
89,650.
Yeah, one of the things that I worry about is should Independence
That
House
includes the
come back.
37.
No.
That's,
It
don't worry
does
about
not.
next year.
Right, but if we use their money,
Yeah.
then,
Clear on it, but it's not.
we will have nothing for them because, but we need to they need to understand that what we're dealing with is agencies that are really providing.
Mhm.
We're gonna do that cost benefit analysis.
Yes,
7,500, but we're getting $750,000 worth of stuff.
right, we're
Yeah.
getting
Along those.
good value for
That's
our money.
I gave them the approach like that.
They're asking for 1%.
1% of their whole project.
And it's a critical 1% because it frees up the ability to get money from foundations and everything.
Right, and
Right.
that's the tack to take for that, and Rich will totally understand that, and I think if he was at that presentation,
Yeah,
he
that's good.
saw the
Started to
big
be-
picture that they're trying to do, because that's why I wanted to ask about
Yes,
that, was
yes.
because they needed to be asking I knew they'd be asking everybody, but there are there are committees that are working on regional solutions to things.
Right.
And,
Yeah.
and that's where this needs to be. All right. Hi, Fran. Have a seat.
Is it miserable out? Is it raining now?
No, it is not
Just
raining,
windy.
actually. It's a little windy.
Okay,
Yeah, my
that's good.
program manager, Jackie, I think might call in if that.
Okay,
works.
if she comes,
Okay,
we
Yeah.
did, the problem is there is a new code.
I sent it to her. I mean, I sent what
Okay.
I received.
It should
today.
work, because other people
Okay.
have used it, so.
And it's
good.
okay if it doesn't, she'll text me and say.
Okay,
"Hey, get
'cause
in."
this is it,
Okay,
if she texts you and can't get into it, so.
okay, terrific.
But
Perfect.
I was typing like this. so I got
Just
it.
get everybody,
To
yeah,
make
the
sure everybody
information.
was like, oh my
That's
gosh.
a little stressful, the last minute change,
When we
yeah.
got here and the door was locked to come in and we were like, okay.
I know, I got to the door and I was like, okay, not opening, let me just.
Oh,
Yeah, so
you
get-
did
Yeah,
yeah,
you did get in. Okay, good.
Yeah.
done that.
It's never-
Alarms would go off, the cops will be here. I didn't mean to do that.
Right, yeah, exactly.
Yeah, it's okay, as long as you, yeah. My husband used to have that happen. The alarms go off and howls in the, it's like, I didn't turn it off.
Yeah.
Okay, so now we have Francie Joseph from Francie
Francie
Joseph,
Randolph.
excuse me, Francie Randolph. I know a Francie Joseph. Francie Randolph from Sustainable Cape Cod. And, just so it comes out in our AI minutes.
Yeah.
But whatever, and so we just had a great presentation, and so we're looking forward to hearing from you.
Okay, great.
This is an interesting project that you've got going on, and I know you were here before and got some funding from us, so we, want to see where you are with what you're doing.
Terrific. Okay, well, our programs are expanding in Eastham. We are now doing weekly programs in the Eastham Elementary School. So let me give you maybe the 100,000-foot view first. So
Yeah.
there's Sustainable Cape. It's actually not Sustainable Cape Cod. Cape
Okay.
is an acronym for Center for Agricultural Preservation and Education.
Center.
So,
Agriculture.
Can I just interrupt you for a minute?
yeah, please go.
So you're the founder,
Yes, and the director.
okay, and are there other
There are 9.
agencies that do this in other areas, or it sounds so unique?
It's
and
very unique.
It sounds, it sounds fabulous. This is up my alley. This
Oh,
is-
good.
I think.
Get her name and volunteer.
Okay, I we have some volunteer experience next week, so welcome to join us.
Really, Ellen, I think you really should get yourself involved.
Right.
You have said, she has said
Right,
this
this is my
multiple
thing.
times, and I really
Yeah,
think this
This
is
is
where,
definitely my thing. So yeah, so you just,
We started, I don't know how much time we have. Let me just see if should I get Jackie on the phone or will it ring in if she calls in? If she calls in,
if she calls,
Oh, well,
oh, she is, no, she's there. She's
okay.
there.
I just know that she's so conscientious. I don't want her sitting there thinking, what's happening?
No, you just-
Probably not supposed to be in the meeting.
There she's,
yeah.
okay.
Hi, Jackie, you there?
Probably take
Ask to
her.
unmute.
Okay.
No, that's it. That's super.
Oh, yeah,
I'll take her, there she is.
okay.
Okay.
And
Can
she
you
won't
hear
be,
us?
she told me that she's in a car right now, so she won't be visual to us, but
Okay.
hopefully we'll be able to hear her. Just let us know whenever you can just say hi, Jackie, when you're able to.
Okay.
But we started with an agricultural fair
Okay.
and, I am an artist. Hi, Jack.
Okay, hi, Jackie.
Glad you're here. And the agricultural fair was, Truro, as you know, well, at the time had a population of under 2,000 people. And we printed 100 posters, and what we really wanted to do was bring people together to celebrate the history of Truro, which is not only fishing, it's agriculture everywhere here, right? But we really focus on the fishing part of Cape Cod. But my husband and I had moved to a 200-year-old home. We had been given 2 sheep because we had extensive lawns and we were crazy and got kind of game. And then we got some hens and big gardens and one thing led to another. And so we were really getting tied into this kind of network of people doing small scale farming on Cape Cod.
Mhm.
And I thought, well, gosh, we should really network these people. And I had been teaching up in Boston and spending the summers on the vineyard prior to meeting my husband. And they have this amazing agricultural fair. So it was
Yeah.
Truro's Tercentennial. So I said, let's have an ag fair. They brought me onto a committee and wanted ideas. And I said, let's do an ag fair. So we did this ag fair. We made 100 posters and 2,500 people showed up. And it was incredible. And I think as an artist, my work had always been sort of about the fact that there is no culture nature dichotomy, that nature is patterns and we read patterns and we're all connected through these patterns.
Mhm.
And so while my work was being shown around the world and it was successful, I felt I was missing something. And I think what I was missing was I was working by myself in my studio and going to these shows and people would buy the work and it would all be fabulous and there'd be articles and then you go and do this and it was just sort of the same thing. And I wasn't like helping somehow in a bigger way. I was saying what I believed, but it wasn't
Reaching a lot of people.
reaching a lot of people. And so when I walked into the first ag fair and the sun was shining and there were all these people and the farmers were kind of the heroes and there were children running around buying all these vegetables and we had, pie baking contests and pie eating contests and zucchini 500 racetracks and all this stuff. I thought, oh my gosh, I think this might be it. And I had never expected that. I mean, I taught at Harvard. I was a Cambridge person. I, wore black boots and leather jackets. I was not this person. And so, but as we had our children and really rooted ourselves here, I realized, okay, there's a lot of work that we can do to encourage and engage with each other. And we can do it around food. And we can do it specifically through local food. So it really became a way to connect sort of this summer crowd that I was part of, along with this now year-round population that as my children were growing and starting schools, I was becoming part of. And how do we connect them all? So we started with children's gardens, and those children's gardens led to bringing the food to the school, which had an abominable lunch program back then. But you couldn't come in as the girl from the city and say like, oh, this is terrible. I know much better. You have to sort of say.
It was good of you to
Yeah.
recognize that, actually.
And I'm not that person. So I said, well, hey, the kids are all growing all this extra lettuce. Do you want us to bring the lettuce? And maybe like somehow I could help and we could get it into the salad bar. So we just started slowly, which is the way we start with every school. In fact, we never go to the principal and say like, we want to run your program in every class. We go, we meet with all the teachers and the nurse. And then we say, hey, we'd love to run a program here. And whoever wants to join us could join us. We're here to support your curriculum. And we're not going to make extra work for you. And we know it seems like we're taking away from some of your class time, but we're very keyed in on the science standards, targeted towards all of those. We can share our curriculum. And would you like this? So then usually it's say maybe 3/4 of the school will join us. Then by the next year, every single school, everybody's in. So
Well, because that's really understanding the teaching part, not making more work for them, but yet hitting the
Exactly.
standards that they have to hit,
exactly.
and
so
having
how
been a
can we-
teacher.
Yes, how can we help you teach the students and can we give this experiential education where we get the kids outside so that once they come back in, they're actually more focused.
Right,
They've
right,
run around
right.
for a bit and they've actually gotten their hands into the dirt. And then the key is when a child, which I learned with our own children, when a child plants a seed, they cannot wait if it's food to try it. It's like a miracle. Like I grew food. This is incredible. And so harnessing that power to get kids to eat more fruits and vegetables, it's like the gateway drug, right? You plant the seeds and they're just all in. And so, I have videos of just huge masses of kids where I'll go and I'll be videoing and I'll say, okay, on 3, we're going to call it our favorite food. 1, 2, and then I'll be like, kale. And you're like, kale.
Really?
And it's because kale grows so copiously and they can snack on it during the program. So it becomes their favorite. So it's crazy, but it's
Can I
true.
send you my grandson?
And it's kind of like a peer learning thing too.
Yeah.
So then anyway, we started then I won a grant from a foundation called the EOS Foundation. This was years ago. And I had proposed, let me do a study of farm to school programs on the Cape and Islands. And let me see, why do they succeed? Why do they fail? And what could we do in our own, right then it was just a Truro school. I'm from Truro, just like my kid's school. And so did this study for wrote up the results. It was a year-long study. And what succeeded was having a paid farmer or paid educator. We turned it into a paid farmer because basically we also want to help farmers. Go into the school, can also educate and grow food with the kids. So we get a garden, we get a paid farmer, we work with the nurse and the health and wellness curriculum, we work with the science standards, so all the teachers in their curriculum, and then the cafeteria or the snack program, if the cafeteria isn't yet willing, because again, you can't go to the lunch ladies and say, we've got something better to do. You have to just offer.
Because sometimes they don't have a lot of power to change that.
No, and also like it's a heck of a lot easier to open up a can of tomatoes than it is to make homemade tomato
Yeah.
sauce. So
Yeah.
you need to get the kids involved and the parents involved and kind of get everybody on board. And so we started this little program in Truro called the Farmer in the School program. And then we moved to Wellfleet, and then we moved to Provincetown, and our next school is Eastham. So we started in Eastham last spring. And I'm going to tell you a story, which actually when after the first day, so we worked with them to build raised beds. They put in sort of a bit of a feed forest along the edge with someone we connected them to. So those are perennial plantings that will continue to grow food for the community. And then we had trouble in the garden because there was all this mugwort and we couldn't get rid of it. So we did these raised beds with the principal, and he had contacts, et cetera, et cetera. So we all worked together, got this garden built. And we were ready now to go in for our first day of planting in the garden. And the first lesson is sort of the garden rules and what we're going to do together. And here's our weather station. We're going to be measure the temperature, and is it sunny? And what is the wind doing? And how does that affect our natural environment? So we went through this lesson, and the teacher, our farmer, said, does anyone have any questions? And a little girl raised her hand. Okay, so this is kindergarten, and it always practically makes me cry. But she's raised her hand and she said, my parents don't have very much food and they don't have very much money. Am I going to be able to eat out of the garden at the end with the other kids?
Wow.
So that's what's going on right now. It's crazy out there. And so, of course, but then part of what we do is yes, of course, you're going to be able to answer the child right there and bring everybody back in the community, but then go and talk to the school and say, okay, this is a family that might have food insecurity. How could we help? What can we do? Who can we connect them to? And so that's also part of what we do. And so when we were doing the Truro program, I first recognized food insecurity. My children were in the school. I had no idea, just really had no idea, just running along. They have play dates. Everything's fine. Hi, Jackie.
She made it home and in the house.
So Jackie is a registered dietetic nutritionist. She came to us as an intern. We hired her. She's now living here full time. Yay! She has risen up and now manages our farmers markets and has also been a farmer in the school and is now, I think I can say this, sort of soon to be promoted to coordinating all our programs. So Jackie is an amazing person and we're really happy to have her here. Okay, but in the Truro school, I was taking photographs of our farmer there doing the program, and there was this little girl who was adorable. She was eating some kale and then she put some in her pocket, and then she'd eat some more and and I was like, oh, I have to capture this. This is so cute. And I had no idea at this stage. And so she got into line when they were going back into class, and she was at the end of the line. So I kind of sidled up next to her and I said, I saw that you were putting the kale in your pocket. That was so adorable. Do you really like it? Do you have it for snacks? And she looked at me and she said, my family doesn't have food like this at home. I'm bringing it home. And then I thought, oh my gosh. So that was kind of my introduction to the fact that right underneath my nose, never having seen it, is pretty severe food insecurity.
Yep. Yeah.
So what can we do? So it became more than just the children's gardens. The children's gardens, yes, we can grow food, we can get the children eating the food, we can get it into the cafeteria, we can even sometimes, if we have enough, get home with them. But then the town kept asking us to start a farmer's market in Truro. And we had said no for a long time because we were doing education, really focus on education. Then we sort of realized, oh, we could do educational farmers markets. And then we could educate a lot of people utilizing the children's artwork and what they're learning in the market. Where each vendor can have an ed board, it's called. So a little bit about the farmer or the fisherman. And then underneath, what can you do in your own home to enable sort of a more sustainable environment? What is it that will help the farmer or the fisherman to be able to harvest more for all of us? So the kids help with this process now. And then I thought maybe we could create this program whereby we give the kids, we first did them as coupons, and then we learned in year one, coupon didn't really work as well as an award. So now we give them awards. And the awards are there are two parts of it. The
That's great.
kid comes with the school field trip, which we coordinate to the farmer's market. Now we do them to the regional farmers market, so we're hoping, we're not making any promises yet, but we're in conversation with the Eastham, the new Eastham Farmers Market, and because Jackie runs our farmers market coalition, she works closely with them to support. But what we're doing is we offer a lot of food access program or a nutrition incentive program at the time. And so we gave the kids these awards. They come with their field trip and they turn them in and you get tokens. And then you can run around and buy things with your tokens and the farmer comes and gets reimbursed with a token. So the tokens are money. So the kids are thrilled. They love the tokens. And it also worked for people who had credit cards when they couldn't get Wi-Fi on the field or the person didn't take Venmo or whatever it was. So we have this program that takes credit cards and we were giving tokens to children. Then I met this wonderful man who unfortunately is no longer with us, but was incredible, had a home in Eastham, and he was the Undersecretary of Agriculture for the United States under Clinton. And he became one of my best friends, an amazing guy. His name was Gus Schumacher, and he was in Massachusetts. So prior to that, he had been the Commissioner of Agriculture in the state of Massachusetts, and we have them down all the time, stuff with good relationships with them. And he had developed a nutrition incentive. And his story was he grew up on a farm. They dropped some peaches off the back of a truck after a farmer's market. A mother came with her child and was picking up the peaches off the road. And he said, no, I can sell you some from my truck. And she said, oh, were you going to pick these back up? And he said, no, I wasn't going to pick them back up, but yeah, I'll sell you some here. And she said, well, I'm going to take the free ones if that's okay. And he just had this moment, like me with the kale, I think. And so he invented what are called bonus bucks in Boston. And we call it a bonus match here across the Cape. So we have the Provincetown Farmers Market, the Truro Farmers Market, the Wellfleet Farmers Market, soon to be, hopefully, the Eastham Farmers Market, the Orleans Farmers Market, Harwich is coming back on, all the way down to Falmouth. Not every single one, because it does take time and energy to run these programs. But if the market manager is willing, we don't have the money to pay them, but we raise the funds for the match. So it incentivizes a person with a SNAP card or a WIC mother for women, infants, and children who get coupons through the state of Massachusetts, or seniors who also get coupons through the state of Massachusetts. And both of those are income related, as well as the SNAP. We have a program for veterans now, and then we have this program for children. So all of those programs exist where you can come to the farmer's market, or you have a credit card, so no one knows who you are except for the Jackie running the machine. And you give your card in and you say what you would like and you get the tokens. And we say, thank you so much for coming to the market and helping us support farmers. This is our mission. We're really trying to support farmers. If you come back every week, we're going to be so excited to see you. We're really glad you're taking out X amount of money. We want to double it. So we then double it with the tokens. So they come back. And there's a purpose to coming. They're helping us help farmers. Yes, you get some vegetables, but it's not a handout. Not a handout. So through the schools, we're able to reach the families that live here with these programs. So it's all integrated, really. And then that led into the Food is Medicine program, because if you know local food and about regenerative soil and agriculture and the microbiome in the soil, the roots of that plant are enabled by the microbiome in the rich soil to take in more nutrients. And that tomato is going to be a really different tomato than you buy in the store, which is grown to ship and store well. This one's grown for its delicious flavor, has a lot of sunshine in it, and all these nutrients from the soil. So it's a totally different composition for what it can do inside your body. And it is not fair that only wealthy people are able to afford this food, and this other food goes to those who don't have enough meat. So trying to really level that playing field. And now through also another state program that runs with the SNAP card, and we're a vendor for this program, and I was on the steering committee to help develop it. It's called the Healthy Incentive Program. So with the Healthy Incentive Program that runs with SNAP, this is a lot of information, plus our bonus program, you can get between $80 and $120 worth of fruits and vegetables at no cost with a SNAP card, while the farmer is paid in full.
Wow.
It's incredible.
How's that work?
Wow.
So
Because-
we do every week you come and we're gonna double up to $10.
Okay.
And then the HIP program gives you, depending upon your family size,
Yeah.
40, 60, or $80 per month. Then you're gonna tack on our $40 onto that by bonusing. So then you get to 80 to
Because-
120.
Until people understand that, which you get people to through
Yes.
the school thing,
Yeah.
is that they won't come to the farmer's market because they feel it's too expensive.
Exactly.
I can
Exactly.
go get for my this much money, this many tomatoes, but
Yeah.
you know, the ones at the farmer's market appear to be more money, and they are, but at the same time, you do get more. Just
Nutrition.
that,
Yes, you get a lot.
nutrition for your money.
And there are some deals too at the farmer's market, but you have to go to know that.
Yes.
And then also the farmers, once they get to know their customers, their weekly customers are often saying, you know, I'm not gonna sell all of this week. Here, why don't I give you a few extra?
Yes,
So the
yeah,
cost of the food comes down.
right, right.
But it's
Or it's
related
more
to that.
blemished and they have it and
Yes.
they realize somebody keeps coming back and they.
Exactly. And the issue with the food pantries, we love and support the food pantries, but they focus on the staples because they're shelf stable.
Right.
Yes,
So where are the fruits and vegetables coming from?
yeah, yeah,
And where the really nutritious fruits and vegetables come from, and how can we get that to people? So now, not even in the application, we're doing a CSA delivery program for SNAP clients. Specifically for SNAP clients. We're raising all the funds ourselves right now, because the state got thrown out of whack with what happened with the federal government turning it off and then turning it back on again. So for 2 months, we're paying for this program completely ourselves. And then the HIP program will help to pay for those fruits and vegetables. Then we do the Food is Medicine program. So that's the same kind of thing, like a CSA, but it's for people that are referred through their doctor's office. They're low income, they're on Mass Health. They've had to answer a series of questions about food security. So they're very food insecure, not just food insecure, but very food insecure. And they have 1 of 8 diet-related diagnoses. And then we deliver this basket of fruits and vegetables to them, and actually lean proteins now as well, some whole grains. And they're able to have this delivery every other week. So I think we have, if my memory serves, we have 7 right now, Food is Medicine patients out of 45. And growing. In Eastham, sorry, in Eastham. Our CSA Plus also has 7. Now, I know the CSA Plus has 7 because I just talked to that program manager. I'm pretty sure I put 7 in the.
yeah, I think you
Emily
did.
has 7 in the thing. And then we also see all the children in the Eastham school, which is 177, a lot of 7s in this thing.
Yeah, that's right. Go play it in the lottery. Maybe you'll have all the
Yeah,
money
you
you
want,
want.
And I know Jackie's been also doing a lot of work with the cafeteria and the children, sort of eating and what they're doing in the school and how it relates to nutrition. So I don't know, do you want to talk a little bit about that, Jackie?
Yeah, it's been really exciting to see the trajectory at the Eastham school from starting a few years ago when we did our drop-in Meet the Farmer program. The level of excitement around meeting a farmer and sampling these fresh items and getting to plant them. But really seeing then that this was very introductory for them and their first experience with this kind of connection with their food system in this way. And to now having the integrated weekly farmer in the classroom and school garden, and the students really excited to participate and enjoy the fruits of their harvest. Like Francie said with the kale, I think this year, my surprise, we tried spinach with the students as a late a late fall green, and it was a raving success. The students couldn't get enough spinach, of all things. But
Great.
yeah, also exciting to work further with the cafeteria now, with our new cafeteria manager this year. There's been a lot of excitement to bring stuff in from the garden, even when it's like the small, like this year, the last harvest of the wax beans. The students enjoyed them in the garden as they were learning about them, but the last harvest we brought into the cafeteria, and it was a small amount, and I was worried she probably wouldn't be able to make anything with it that all the students would be able to have, so maybe she wouldn't want it. But they were excited to just super excited to bring something in from the garden that they knew the students would enjoy because of the excitement around the program and enjoying what they have helped grow. So put them in vegetable cups for the students to choose and sample right off the line.
Good job.
So,
I mean, you
yeah.
something.
Mhm.
That's the best way to eat the beans, I think. Yeah, it sounds fantastic, and I know that it's, the idea that the kids are, get to understand more. I mean, some of the families, the parents are working multiple jobs.
Yeah.
So they don't have time to do too much of this growing anything at their homes. And, and kids, they see all this bounty in the grocery store if they go with their parents, but they have no idea where it comes from. And, I think it's a good thing for them to understand, because it goes off to sustainable, that we have to, if we want food, we have to protect what's
Yeah.
around us.
Can we go back to the
Yes.
garden at the elementary school here in Eastham? You
Yes.
had something growing in the ground,
Yes, so,
what is that called? The,
a food forest.
no, the,
Oh, mugwort.
Mugwort.
yeah,
Yes,
mugwort.
mugwort.
And so what did
It's a
you,
weed,
what did you
yeah.
do? Did
So,
you-
well, we tried to get it,
remove
yeah, we work with AmeriCorps a lot, so we get AmeriCorps teams to help us in different
Do
aspects of
some
our
of that heavy,
programs, yeah.
heavy lifting. that
Jackie was right in there, leading them.
Good.
And so, we tried to start with digging it out. We thought, we'll dig it out, we'll put a perimeter, down in the soil so that
Yeah.
the roots can't get through. And then we just realized that we're never gonna win this battle. We can't.
There was a bunch of bittersweet in there too, with roots like this
Yeah.
big
Oh.
around, and yeah.
So you-
Well, because that whole
raised-
area,
Yes.
when you say raised bed, are they like 3 feet off the ground?
So
or-
what the principal chose, what he really wanted was, it almost looks like a horse trough, those
Yeah.
horse troughs of the old,
Yeah,
so
yeah.
it's like this end, and then it goes around to you. And is around there. And so they're about that big, and then we put them about 4 to 6 feet apart, so you can get a whole class in there, and you can be on one side teaching and all the kids can get over. And so we have them all laid out now in the garden area.
it's
and
at the back of the playground.
Back of the playground, yeah.
Yeah.
Because that had been so neglected for so long, I'm not surprised there was mugwort, but.
Yeah. It was rugged. We had high hopes, but no, we could not garden in the
So
ground.
you gave up on it, I think, until you got,
Well, we had to get that sorted,
Yeah,
so
yeah.
it wasn't clear what the principal wanted, and again, we can't come in and say, well, you should be doing this, we say, here are your options. And here's what works in other schools, and here's what we're doing here, and, talk amongst yourselves.
One other question as a farmer. So
Yes.
so now the garden is above ground.
Yes,
And earlier you talked about the difference between the tomatoes that are shipped and the tomatoes that are
Yes.
grown and have all of the,
yes.
and
Yeah, so
Yeah.
that's an excellent question. So we bring in organic soil, and then we have compost that goes into it. We start usually composting programs with the school. That's, and so sort of second level. And then we also, for instance, AmeriCorps just came on Monday, was it? I think it was Monday was the AmeriCorps day. And so they've brought in, we don't widely advertise this because we're just worried someone's gonna come and say, you can't do that anymore. But a lot of people put salt hay in their gardens and eelgrass. And so we go and we collect from different areas so that we don't disturb any one area too much, salt hay and eelgrass. And then we layer those on the beds in the fall, early winter, so that it's decomposed and acting as a substrate when we're ready to plant in the spring again.
So what do you compost?
Okay, do you want to talk about the composting? So we don't have the composting really going on in Eastham yet.
Farmers over here.
You can talk about the
Over here,
program
wanna know
in
all the-
P-town a little
That's
bit?
right.
Where did you get your soil?
Yeah.
Soil,
Well, we've done it in a couple different iterations too, because it does directly tie into especially the 5th grade science standards, composting. So in other schools, we've built up through grants and things to have a couple of different systems of composters, having an open 3-bay bin where we can put all of the green debris from the garden in and mix in a good ratio of brown and green materials. And what was that? Sorry.
The food waste, so the food waste question.
So we've moved away from putting the food waste into the open bin up there anyway because of pest issues. But they also have a tumbler and that's where we put the food waste for the students to see the cafeteria scraps go in to the tumbler. But a lot of the schools now are also partnering with Black Earth to pick up compost for their like full scale of food scraps, but it's nice to still be able to utilize the open bay and the tumbler at the school for the students to really visualize their food scraps going in and coming out as compost that we add to the soil to help amend the soil.
Yes, because it just sort of becomes this mystery process, but
Yeah.
yet if you can do that kind of a thing.
And then there's the company, something of Maine, what is that again? And then I want to talk about leveraging our relationship with them where they donate the bags.
Coast of Maine.
Yeah.
Yeah, Coast of Maine.
Yeah, usually it's as a commercial property, commercial, yeah.
Yeah, they run grants for like school garden programs and things that we
Another good reason to buy stuff.
yeah, they're very supportive and super awesome. And the soil and the different products, they have all different sort of soil amendments, all organic to add, especially to the raised beds. It's really helpful. So that's been a great partnership as well. Each year
I think it's, oh, sorry, go ahead. Didn't mean to interrupt.
Yeah, each year, and it's a great partnership also because we get the soil through the different local like hardware or garden stores throughout the different towns. So then we form partnerships with them as well too.
Do you get to use the compost as a composter over at Eastham Transfer Station?
Oh, we have.
You get to use that? I don't know where that goes, do you?
The big, it's an old garbage.
People get
Yeah.
kind of get it themselves?
I think it goes to black.
If you don't know what goes in there, yeah, it could be seed, or it could be that someone, does a massive fertilizing of their lawn.
And
And then,
you don't want
and
that
then
quick.
somebody else comes in and is cutting their lawn and they put the grass in there,
Right.
so.
The food compost at the dump, I think
just the
goes
food.
to Black Earth.
Yeah.
I think it does. Yeah. Mhm.
A little counterintuitive because they drive it all the way up to the
Yeah.
shore.
I know.
So I don't really love that program.
Yeah. But it is,
But in Orleans, they do a whole, composting
Of
situation.
their own.
Yeah, with, leaves and,
Yep.
yard debris and so on. And they do it the right way so that they give it to the farmers at
Putnam
Buckner
Farm,
Farm.
yeah, with Jackie's one.
You don't
There.
put them for
Good stuff.
Yeah.
But
Do you bring the
that's,
kids there? Do you do like field trips there?
We haven't yet, but it's definitely something we've talked about.
Yeah,
It would be great to bring them there. Mhm.
to get
Very
a
fun.
chance to see something, another spot besides the one just at the school.
Well,
Yeah.
yeah.
We usually do a farm field trip and then a farmer's market field trip. So we do both of those so the children every year can see a different farm. And then also can come to the farmer's market where we create a scavenger hunt. And so they're learning with a team, going through and having to introduce themselves to all the different farmers. And then they also can understand the value of what they're growing at school. And then they get the tokens through their award, and then an award goes home with them as well, so that they go home and say, hey, I want to go back there and do that. So
Is there any part that you kids can like bring home plants and try to grow stuff at home themselves?
yes, so
I mean, that,
yeah, we've definitely done that. We have pictures that, parents will post on Facebook or send to us, like, here are the peas. When did we cut them? When we talk about doing pea shoots and then giving them haircuts.
Yeah.
He's ready to give it a haircut. Is it tall enough? So
Awesome.
it's really fun.
That's great.
Yeah.
Every spring, we try and send them home with a take home at their last class so that they can grow it throughout the summer. And one of our lessons also is kind of a democracy in the classroom, and they vote for their favorite crops and they do a whole campaign, and it's quite a beautiful process and really fun to see their creativity and energy behind what's growing in the garden. So they get a vote on what's growing in the garden. And a few years ago in another school, they voted on watermelon, but there wasn't enough space in the school garden to grow enough watermelon to be able to share with everyone. So everyone went home with a watermelon plant to plant. And if they didn't have space at home, they could give it to their friend to plant for them. And I heard charming stories of, oh, Johnny took my watermelon home and then he brought it over and we tried it. And so it's always pretty sweet too.
Yeah. And it's a neat process, the democracy in the classroom through the plants, because the kids really, they have to form committees and decide which seed they want to vote for, and then they do campaign posters, and then they caucus, and they go all the way down towards 2 candidates, and then they vote, the whole school votes, and then oftentimes the principal will get over the loudspeaker and announce the election results of what is the chosen plant next year.
What a great way. I mean, it's something they're invested in. They actually get the process more because they've been doing it. Okay.
Pretty cute.
All
So
right.
it's a great program.
you have volunteers?
We do have volunteers. Yeah, we always need
Volunteers.
volunteers. Yes. Hey, Jackie. That'd be great. Yes. We should.
Ellen is definitely signing.
I'm gonna get you to sign up right
Awesome,
now. Wait a minute. You want my pen or your?
I got it.
Okay.
Good.
Yeah, so give me your name and your email address. That would be
What
great.
background is it psychology?
My background, strangely enough, is in something esoteric called visual and environmental studies. And then I went on to get a master's degree in education, but in art and technology and education. So I'm a visual artist, really interested in making everybody able to see relationships that we have with each other and the earth.
Yeah.
So-
But this comes into it.
It's what we're doing. I know. And people say to me all the time, don't you miss making your artwork? And I say, I'm making my artwork every day. I just get to make it with all these amazing people I keep meeting.
Something different.
So,
3D and live.
yeah,
Yeah.
3D and live.
Yeah.
Yeah. And everything, from the Undersecretary of Agriculture to, like some of the, there's a janitor at a school who's so into what we're doing, and he's always talking to us about the irrigation system and what we can tweak. And it's not, everybody's equal and everybody has so much to add.
Yeah.
And I think that's really the lesson in all of this.
Absolutely.
Well, it's all related to climate change and, I mean,
Yes.
there's just so many, areas that you touch on that are
Yeah.
future.
The carbon sequestration. And I really believe there's a fabulous quote, and I don't really have it in my head right now, but it's something about, if a child has no experience with the world, they can't then grow up to make a difference in it. You really need to give them that, I've got my hands in the dirt. I went outside and I, collected leaves and made this beautiful pile of like red to yellow and then
Yeah.
took photographs of it. Or I ate this amazing leaf of lettuce and it tasted like nothing I'd ever had before. All of these, we do something called the Great Mustard Challenge, where we have like really mild mustards all the way up to mustards that are so hot the child is eating it. There's tears coming on their face. They're like, I can do this. But to teach, there's so much variety in the world, and diversity is what we need.
Yeah.
We need diversity to thrive.
Makes everything healthier.
And
Yeah.
it's
And
just a
you can do
lesson.
it through different mustards and you
Yes.
can actually still teach it because you're talking about food.
Right, exactly. Yeah, we're not being illegal yet. Yes, and so then part of what we want to do that isn't even in here is to, or Jackie is already talking, and has been since it started. They've been talking with us about the farmer's market, but to connect now the school to your farmer's market. But your farmer's market first has to be comfortable running the SNAP program, which just last year was
It's their
just getting up
first
to
year,
speed.
they were
Right.
just.
You gotta go slowly. You can't throw things at people.
Mhm.
So
Yeah, yeah.
this year, we're hoping the SNAP comes online and then we can do our bonus match program, but none of that's actually in the application because it's not definitive yet.
Yeah,
But just so you know where we're going with this.
But this, they can go to, let's say they went to Orleans Farmers Market,
Yes.
they could participate it through there.
Absolutely.
Okay.
Yeah, or Wellfleet or
Yeah,
Truro.
yeah.
So we usually have to pick a one that's not on a Saturday. That's the only problem.
Right, for a field
Yeah.
trip, for sure,
Yeah.
yeah. And well, East Hamp's is on
Yeah.
Friday.
Yep,
Yeah, it would be perfect.
it would be perfect.
Yep,
Yeah.
yeah, it would be and stuff,
Yeah.
yeah.
So great.
Yeah.
I just want to.
What do you want?
Both of you. Great.
We want $7,000, right? 7,777. So
So seven rolling.
Seven.
Lucky seven.
Yeah. You do get money through the school budget.
Yes, there's a cost for the program, so the school pays for a portion of it. And so we usually help them, to understand grants that they can write. It takes a long time to get it into the budget.
Yeah,
It's a year-to-year thing. for a
yes,
long
yes, it
time.
is, and so,
Um,
yeah.
And so I think Truro's really the only one that's definitively in the budget. Wellfleet and P-Town are never gonna let it go. We know that, but there's different ways to make the money come
Right.
out of your budget.
Yes, yeah,
And East Ham's really in the nascent stages of, I mean, they love it. It's fantastic. I think, Jackie, what was that story you were just telling me about you ran into the kindergarten teacher?
Yeah, so I have been intermittently in this school, assisting the main educator and the farmer educator at Eastham, and I ran into one of the teachers just out in town, and she came up to me and she's like, "I have to tell you, Jackie, they love the other farmer at the school, but I keep hearing, where's Farmer Jackie? They miss you and the program." So it's always charming a student, and I cherish the name Farmer Jackie, knowing that they have a positive experience with me in the garden. Yeah.
Yeah, and then we have a farmer, Stephanie, too, and she says when she gets out at the Truro post office, there'll often be some little kid from across the lot that will scream.
Or I just saw someone at a store the other day and I hear little girls whispering, "That's our farmer, that's our farmer." And then they're telling their mom, and their mom's like, "You're what?" Yeah.
Yeah, so,
Wonderful.
right. And if anyone else wants to get involved, this isn't, you're welcome to sign up too. We're doing a mailing next week and it's no farming, just like stuffing envelopes.
Yeah, right. Somebody asked me if was a really good farmer.
yeah.
Oh, really?
Yeah, Michael Santarelli, he grows stuff like.
Oh, my gosh, I'm not sure I knew Michael Santarelli.
Ooh, there's a new connection
Full time,
too.
yeah, for a couple of years. And I think he's a nurse at Outer Cape too.
Oh, my
Oh,
God.
do we know Michael Santarelli, Jackie? I feel like I'm not sure I do.
Don't think he's in Truro, you said?
Huh?
Lives
Lives
in
in
Truro,
Truro.
yeah,
Yeah, those are Truro.
Huh.
yeah. And then we've got this program too that's called Grow Row for Neighbors. So we try to encourage people to grow extra food in their garden and then to bring it either to the farmer's market, which we really like to do because then people shop when they drop, but then they also, and then we get it to either the nearest pantry in need or a community refrigerator, which you guys now have.
Yeah, we do have now.
Yeah.
too.
So, and then there's more food for everybody. And so the idea is really just to get all of us growing
Yeah.
more,
Yeah.
and then there's gonna be more food and more food security.
Right.
So it's
I
not
need some of that soil though, that's my first priority.
Yeah.
Not a lot grows in sand. and I
No,
can't
not a lot
seem
grows
to
in
get-
sand. No, turnip.
Compost, you've got a compost.
You do have to compost, but it makes sense because it comes out of your house anyway, so.
Yes, right.
No,
Right, otherwise you have things grow with it.
It is incredible. And then it's also incredible how it can like get hot. My husband got so into the compost one year that he was using a thermometer and I was like, hey, we're going overboard on the compost, I think.
And then you really kill all the seeds and all the.
Yeah,
Yeah,
exactly.
Yeah, yeah.
Yeah.
Like some of the big cities, San Francisco, with all the restaurants they
Yeah.
have, they do a massive composting
Yeah.
program from the restaurant
Yeah,
besides the residents.
yeah.
And then they do it all and use it on their grounds.
Yeah, and I think
It's a-
Alec, his wife of Max Seafood, tried to do that, but the problem was nobody wanted it in their backyard. There was no place to put the compost facility out here,
Oh.
so nobody,
Well, there's-
they were
yeah.
worried about the,
Wells and
and-
biochar.
yeah, I know, he's incredible. That's an Eastham field trip every year, the fifth grade goes every year to the biochar.
Had cucumbers and cherry tomatoes going out of my geranium plant.
Yes,
They used the compost.
yeah.
With the soil and they did well and they eat produce.
Yeah, it's amazing, isn't it? Yeah.
Crazy, had this bond.
They love geranium.
Coming out of the geranium.
I know.
Yeah, we have a pollinator bed on a hill, like near a stair at the Provincetown Garden. And we don't want the kids on the hill. There are raised beds that are tiered, but Jackie has so much trouble because the tomatoes will start growing out of that bed amongst the pollinators. And then she's trying to keep the kids away from the
Picking the
tomatoes.
tomatoes.
Yeah, exactly. They're not allowed on the hill.
Yeah, because if you've got the pollinators, you have too many bees and
Yeah.
you're worried about.
Volunteer.
Volunteers.
Yeah,
Yep,
yeah,
exactly.
Yeah.
Exactly.
Right,
They're
right.
usually hardy because they
They
start
do.
getting fat. They
Yeah.
get it on
Exactly.
their own, you know, so
Exactly.
They like in that environment.
Yeah.
All right.
Yeah,
Well,
okay.
so we have, I mean, you have requested $3,000. We are not sure. We have been asked to level fund, but we are looking at good programs and such. So we're, you know,
Out to fight for you.
we're out to fight for you and
Okay.
such. So we,
Thank
you
you.
know,
A good team behind.
we can figure out a way to, you know, somehow support your program because I think that it's in the school budget and potentially, you know, somehow that eventually it will be funded by them, but in the meantime, to make it, you know.
Yeah, and what we try to do is we only charge the school, and I don't know really why we do this. We only charge the school usually about half. And then we say to the school, we will try and raise the other half. But human services groups in different towns really step up for this because they see the value. So that's very, very helpful. And then things like getting the compost or having AmeriCorps help for free, things
Oh,
like that.
yeah,
We
all
do
those
everything we
pieces do
can
help.
to,
Yeah.
keep the program cost very, very low so that we keep operating it.
Keep up, right?
So,
All
and
right.
volunteers are very helpful.
Yes. So we will see, because we're, you know, on a crusade to try to figure out how to support all these good things.
Yes, I'm sure you've seen lots of good things, and
Yeah.
there's so much need right now. I mean,
And there is
really,
so much,
it's
but,
crazy.
but-
It's gonna be like for the next 3 years too. so.
but there is,
Yeah.
I mean, good food, as we were just hearing about good health, that good food is a piece of good health.
Yeah, it's kind of the key. The leading cause of death in the United States today is due to food.
It's
Due to food. It's the food that people choose to eat, but it can be the culprit, but it's the cure too.
Yeah.
It is absolutely the cure. They are seeing,
Be there like medicine and medicine be
Yep,
like food. right?
exactly.
Socrates.
Yes, exactly.
Whoa,
Yeah.
we're really getting deep.
Yeah, so we just had a neat, I won't take up tons of your time, but we just had a great, I've just proofed it. It hasn't come out yet. It will soon be out. But the Harvard Law School has done a case study on our food is medicine program because ours is hyper local. And so I speak across the state on the importance of taking these healthcare dollars and sinking them back into the community that we're trying to heal.
Yeah.
And how important that is economically and to enable farmers and fishermen to have thriving businesses so that we can have a more resilient and stronger local food system. And so it's gaining traction, which is great, but I'm just so excited because they picked one group in California and then our group.
Wow.
Anyone else in the
Yeah.
United States. So
Awesome.
Really, really excited about
Proud of
that.
that.
That's a lot.
Yeah, so.
Thank you for being here.
Well, and Jackie too,
And
Jackie does
Jackie,
all the
yes, yes.
intake of
There you go.
every single one of those patients. And then figures out what foods they're getting
Yeah.
on their diagnosis.
Excellent.
You're really growing networks
Yeah,
on every level, so
It's-
it's really.
I call it a deeply rooted food system. It's very integrated, and what
Yeah.
we do is we just keep, the roots just keep getting deeper and overlapping, and that's the idea, and bring more and more people
Yeah.
to the work as you go and do it, because that's what it takes, it's all about relationships.
Are you writing this up so that we can publish them? I'm serious.
I'd like to
Yeah.
do a book. I'm so busy doing it. That's why we're bringing Jackie up, so that I'll have more time to write.
Have to.
But I think, and also I'd love to photograph this stuff, so I've got thousands.
Yeah.
Oh, I'm sure you have.
Of,
Like, the thing is, that would
children.
really help your book get, you make it be vibrant.
Yes, exactly.
Is this another visionary here?
Yes.
Yeah, there you go.
We've got two visionaries tonight.
Well,
Yes.
Thank you so much.
Thank you so much for listening.
Connect
I
with Davey
really-
and
I
I.
really
Glad you
appreciate
were
it.
here.
Thank
See you
you.
again.
Yes.
And
Thank you very
for
much.
being here the night before
Yes.
your vacation, Jackie.
Oh,
Yeah. Thank you all for your time and consideration.
Okay, thank
Have a
you very
safe
much.
trip.
for
Thank
Jackie.
you.
Bye.
Bye.
Okay. Bye, everybody.
Thank you.
Happy holidays. Yep.
Okay,
Fantastic one.
Yes,
all right,
This was a good night. Really.
yes.
When I was a psych, when I was, I ran a psych unit for a few years up in North Adams, and there was a farm there, a CSA. And I did everything I could to get these people out of the hospital and and do something. And I was able to get them there a few times and, shuffle hoe and, just to be out in nature and then just, bring some stuff home. I mean, it just.
Because one of the treatments for depression is actual physical exercise outside,
and-
particularly outside
Yes,
and
yes,
stuff. And it really,
Yeah.
it does make a difference, and that, the connection and just,
Rather than bringing them outside for smoke, that's what we were doing.
Yeah.
Oh,
Yeah,
yeah, right. Yeah, that's what they were playing.
All right, who brought the popcorn? Oh, where
Very
did you
good.
get it?
I
You
made
made
it.
Yeah.
Oh my
homemade.
God.
You
We
made
have to
it?
live at your house for now.
Take it.
Oh my God.
It's a King Arthur Blow recipe that I found years ago, and I make it, yeah. It's that hard, but you need maple syrup.
Oh my God.
Move to accept the minutes from last.
My baby.
Oh, okay.
Yeah, we have.
Okay,
Yeah, we
all
do
right, so
some
we
business
have a
stuff.
motion about the minutes. Since we didn't get to those at the beginning. They came in through email this afternoon at about 5.
Maybe that's what.
Or 4, maybe
And they were
4.
excellent, and
Okay.
Kate did them because she
All
didn't
right.
get a.
I didn't get the AI
Yes, they did
minutes,
fabulous.
so I created some.
All right, I motion
Out of
to
my-
approve the minutes.
Okay,
Good.
All right,
all in favor?
Aye.
Okay.
they were excellent, Kate.
Okay, thank you. And if we get, I don't think I'm going to get that transcript because I guess it went to somebody's junk mail and it probably got thrown away. But I should be able to get it this week because the Zoom passcode has been changed so that it goes to Rafal, however you say his name, and he will be hopefully sending it to me and I will then be able to create the minutes out of it easily. But, it was this whole thing that happened also right before all of a sudden he's telling me, but the Zoom thing was, and I knew Damien was coming in through Zoom. And I knew that I had given it to Francie and Felice, so I am like madly typing and hoping that people see these new Zoom codes. And then when I walk up to the door and the door is locked, I was like,
And we pull up, we see Kate at the door, we go, kick it in. Oh.
so
It
it all ended up being a fine meeting, a fine night. It was like, oh my God. No, because when we got there, it was truly locked. You couldn't
Oh,
even do that. We had to absolutely unlock,
Okay.
running all the way, but Anyway,
What are the two, on January seventh, which two organizations?
yes, the next two are, oh no, and January 7th, we only have one,
One.
Okay,
and it is, housing assistance.
okay.
So we will have that.
By then. I'll try to do it by Zoom.
Okay,
Okay.
okay, housing assistance.
Hang
And then we can start giving some more talk. I will have talked to Jackie a little bit about this and, you know, particularly about Outer Cape and ask her what do we have to
Miracles
do?
He could pull out of the bag, yes.
You
There
know,
you go.
and,
So did we, talk to Jamie or?
no, I have not ever
Okay.
heard from Jamie.
All right.
So I'm gonna go the route of starting with Jackie,
Okay.
and if I will ask Jackie a better way to get a hold of Jamie if we think we need to do that. And,
Have her
or at
number?
least, I don't,
I think I have it.
Do you know, maybe ask Jackie. How she recommends we approach this.
yeah. Yes, and I think that's what I'm going to do, is does it? First of all, the money for Outer Cape Health, I feel is, or almost needs to be its own little piece. Because of the enormity of that, what that is, that 1% sort of represents. It's not just to increase the funding of an agency.
Right.
It's a bigger project that is truly gonna help Eastham residents. But then, you know, to feel like we have any amount of anything more, how do we go about doing that? And I mean, she may say there is absolutely nothing, or
Let me see what I can do for.
I mean, if they're doing an override, do we get to put an amount in there or something? I don't
Do
know.
we vote? It's a town meeting or
Every department
this allocation?
comes to them,
Yes,
every department.
Select board?
Yeah, they do.
Every department comes to the select board and the finance committee.
Yeah. Yeah.
And they ask
She likes to be
Or-
text.
what they
Texted.
need.
Mhm.
thank you
Mhm.
Now,
very much.
it's not always what they need, it's what they want,
Mm-hmm.
because
And-
that's how you act,
Yeah.
what you want,
Yeah.
right?
Mhm.
I think in our I can honestly tell you that this will be my last year. If we cannot take care of our people, I can't be part of this any longer. And that's not a threat, it's just reality for me. I can't. It's angst for me.
Yeah.
She needs to understand that we are all very serious people who feel so strongly because we have to sit here every week. And I think if you don't sit here every week, you really don't hear.
Yeah, they're
it.
buffered.
No, right.
They're buffered. Little buffers.
Life goes on for everybody because it has to.
Mhm.
But I go home and I angst over this. It's like, there are children who can't eat and I think of my grandkids who have too much.
Yes, yeah,
Mhm.
yeah.
You know, right?
Yep.
They have
Yep.
too much.
Yep.
And it's Christmas and I think, "Ah, I know what my grandkids are getting and I know what, and it's like, we have to be able to do something for our own. There's money.
There is.
And we have
It's
to-
not for us.
So you have to go before the finance
Yeah.
committee and ask for
Yeah.
it. And tell them why.
I think,
we're
I think
asking for
a
it.
few stories like
Let's,
the child that had
Finance or-
ate kale, but also was put his tail in
Oh,
her.
do we
could
adjourn?
I have a motion for adjourning the meeting?
Yes,
Okay.
I move. We agree.
I second.
Second.
All in favor?
I.
Any opposed?
Right, midnight.
Okay.
You ate too much popcorn.
Okay, we will adjourn the meeting.
Yeah.
All right, and so Felice,
Yes.
we're gonna adjourn the meeting, but, I will let you know if we come to any agreement.
Good night.
Okay, when is our next meeting?
January 7th.
Okay, so this
Happy
is
New
it.
Year.
Happy holidays.
Yes.
Happy holidays. Happy holidays.
And our next one is January 7th, and that we just have the housing assistance that night. And then we will be able to also then have some more discussion. We may have a sense of can we, add more money into our budget or not by then? Or we will come up with more, a game plan. Okay?
Great.
All
Well,
right.
happy holidays, everyone.
Stay warm.